You may or you may not know this, but here are 5 common reasons why people get leukemia. First of all, what is leukemia? Leukemia is just saying blood cancer. You can have different types of blood cancers, and even within the specific types, you can have different subtypes of blood cancers, but nonetheless, it's a blood cancer. It's something growing all over your blood, in your blood, that shouldn't be there. Number 1 is chemical exposure, whether that's cigarettes or certain cleaning detergents or pesticides, or being around fumes. Let's say if that's your job and you're on the oil rig every day for 20 years. Number 2 is viral infections. And what's interesting about this is that 100 people could have EBV or HTLV, 2 different types of viruses, but it's only like 1 out of 100, or even a little bit more, but a little bit less, but around that general area, that even end up with leukemia. So it's not the majority of people that have that virus or viruses. Number 3, people that are exposed to radiation, especially if they've already gotten radiation therapy for previous cancer, can be at a higher risk for leukemia. Number 4 is that it could be genetically inherited. So that could either be Li-Fraumeni syndrome, Fanconi anemia, and even people with Down syndrome have a higher risk of leukemia. And number 5, and this is probably the most common, is as we age, the way our body is able to repair itself slows down, it gets bad. So your genes, when they're replicating, they might make a mistake here or there, and they might mutate. And when you have a certain genetic mutation that leads to leukemia, that's how you can get leukemia.